Minnesota Coronary Survey. This is the largest ever randomized controlled trial on the diet heart hypothesis. This is one of the best studies, if not the best study, showing if cholesterol saturated fat causes heart disease. What they did was they divided these 9,000 men and women into two separate groups. One group was fed traditional American food with at least 18% saturated fat and cholesterol in their diet. The other group got soft margarine, so seed oils, in place of their butter, whole egg substitute, low-fat beef, and dairy products filled with seed oils. You can pretty much think of Oatly with the canola oil in the plant-based milk. Here's the thing, both diets had the same amount of total fat, but the intervention group had half the amount of saturated fat and limited their cholesterol. What the authors found when they concluded this 4.5-year randomized controlled trial was that there were absolutely no differences between the two groups for cardiovascular events, cardiovascular deaths, or total mortality. It didn't make a difference. But one thing that they noted was that cancer was a lot higher in the low fat group. And maybe most interestingly and kind of sinister is that this study was completed in 1973, but it wasn't published until 16 years later in a relatively unknown medical journal where the authors knew nobody would find it. So they just hid it. That's not what good research